Hi everyone, thanks for joining. We're going to get started now. This will be approximately 1 hour, and just a reminder, one question, one follow-up. Today we have Dr. Williams and Dr. Brown here today, so I'll turn it over to them to get started.
Good afternoon. Thursday. It means two things. One, we look back at the week and see what's gone on, try to look at what's happening in the weekend ahead. And it's been 2 weeks since we had Dr. Brown from the scientific table and our modeling group to give us an update of the analytics and see how we are doing with our different steps and processes and updating us on how things are going with the so-called variants of concern and our impact here in Ontario and other jurisdictions. So with that, I know there's a fair amount to cover, so I'm going to hand things over to Dr. Brown, and thank you for being here again today with us.
Thank you, Dr. Williams. So the data today will show a clear improvement and a clear path forward. But only care and caution will protect the gains that we have right now. If we are very careful, we can imagine a much better summer. And a better summer is the payoff from the stay-at-home order and the vaccinations. But if we let up, we will, with little doubt, lose the gains that we've worked so hard for. The best analogy is a minefield. Case rates are down, and the extended stay-at-home order in the GTA has been a powerful protection against more rapid growth. But the first dangers are immediately in front of us. Case rates are already rising in some of the public health units again. The new variants of the virus that first appeared in the United Kingdom, South Africa, and Brazil are another serious hazard ahead of us. In the United Kingdom, cases tripled in a month before much more severe lockdowns brought them back under control. Big jumps in mobility or big increases in gatherings will create the same kinds of dangers for us. Cases will likely explode if the virus gets into conditions that create superspreader events. And traveling across the province, from high-risk communities to low-risk communities, can ruin the gains in those public health units where the pandemic is already under control. Simply, we need to watch our every step. There is no easy path through a minefield, just care and caution with each step. I want to emphasize that this applies across all of Ontario, whatever the local public health measures are. We are no longer under the same rules everywhere, but we are still facing the same threat. An outbreak in one public health unit can easily cross the road to the one next door. It is easy for the virus to move between towns if people are moving. If the experiences in the United Kingdom and other countries that struggled with the new variants are any indication, any part of the province can go from a good situation to a bad situation in a matter of a few days. Indeed, we've seen this exact situation play out here in the past few days in Canada, in the province of Newfoundland, and right here at home in Northern Ontario. It's days, not weeks. Care and caution are particularly critical for our health system, for the health of the people working in our system, and for our ability to care for all patients in Ontario. Intensive care units, the highest level of bed that we have, still have more than 300 COVID-19 patients, and a rapid increase in COVID-19 patients in one public health unit can hamper care for all who need it there. Now, a better summer is in sight if we work for it now. The December lockdowns helped keep infections out of our long-term care homes, and prioritizing vaccination in these same homes protected their residents. Together, these changes likely saved more than 300 lives alone between December 14th and February 10th. We can save more lives, further reduce hospitalizations and intensive care unit admissions, and keep kids at school if we remain cautious and if we keep focusing our efforts where they will have the biggest impact on hospitalizations and deaths. Slipping now will have grave consequences. Readiness is all. Finally, before we get into the data, let me emphasize why the next few weeks are critical. COVID-19 is still here, and the proportion of the variants of concern is increasing. Vaccines are coming into Ontario, and we're able to move towards more and more vaccinations. Multiple, rigorous, and published studies show that these are safe vaccines with a high level of effectiveness, and the ones we have do provide protection against the new variants. But we have to give the vaccines time to work at the population level. We all know that the new variants spread more quickly than the old variants. We need the next few weeks to understand how the variants are actually changing the pandemic, especially with schools open. We also need time to roll out vaccines. The next few weeks will give us a map through the minefield, but we cannot afford to rush through the minefield before we have that map. With that, let's get into the numbers. And I'll just apologize that when we do the projection of the data, we'll lose the sign language translation. My apologies, but it'll be right back after we finish the slides. If we could put up the slides, please. Thank you. We'll start where we usually do, which is the key findings. So as I noted earlier, we have seen a decline in cases, hospitalizations, and ICU admissions. But these declines in cases, in hospitalization, and ICU occupancy are slowing. Public health measures have decreased transmission and have slowed the spread of the variants of concern. Variants of concern, such as B117, the United Kingdom variant, continue to spread across Ontario. Cases, hospitalizations, and ICU admissions will likely soon increase, and we see this consistently across virtually every model that we run. Evidence-based approaches to key public health measures, such as focusing vaccination where it has the biggest impacts on deaths and hospitalizations, are the key to controlling the impact of the pandemic at this point. But the next few weeks are critical to understanding the impact of the variants. There is a period of remaining risk before the pandemic likely recedes in the summer. And we can keep the gains we've made by watching spread very closely and by loosening public health measures only carefully. We must be nimble in applying public health measures to extinguish flare-ups quickly. And there will be flare-ups. We just need to stay on them and work very quickly through them. Let me go to the first chart. This shows the new cases per 100,000 per week across public health units. I think the first thing I want to note is that the lockdowns have been challenging, but it is clear that everyone's efforts and sacrifices have had an impact. This is not unique observation to Ontario. We've seen this in virtually every jurisdiction where it has been studied. But you can see that we're able to get control over the surge and bring it back down. However, two things to note importantly here. First, that black line, which is Ontario, has started to level off. It was on a very nice decrease. It's now leveling off and will likely stay so for a while. And we are starting to see some public health units with increasing case numbers. And we are seeing some of our largest public health units with some of the highest levels, like Peel, Toronto, and York, actually starting to trend in the wrong direction again. Now, when we see increased cases, an important thing is to determine whether or not we also are just seeing that because of increased test numbers. You can see here actually overall testing in the province is down slightly. So the higher case numbers are not, or the more cases we're seeing are not an artifact of just more testing. It is important to note that in some of the public health units, though, testing numbers are starting to trend up, so we always need to be cautious in how we're interpreting that. And so, we look at cases, we look at test numbers, and we also look at positivity, which is what you'll see here. And as you can see, the percent of tests that are positive in Ontario has started to trend up again. That's that black line that's starting to hook up there at the bottom. And you can see that it is also trending up in a number of the public health units. So we see positivity up, test numbers slightly down, cases up. This really probably represents the level off of what we've seen in terms of the downward trend in cases, and we're likely to see increases in cases very shortly. Now, this is a good news story. We have seen a substantial reduction in the daily death rates in long-term care homes, and a substantial reduction in the cases both among residents and staff in long-term care homes. This is data from yesterday where we had 20 resident deaths in the last 7 days. Restating that data today would give us an even better number of only 12 resident deaths in the last 7 days. That is substantially better than 4 weeks ago, and even still much better again than 2 weeks ago. So a substantial improvement over time. And you can see that green curve, which is cumulative deaths, actually starting to flatten out and hopefully will stay as flat as it can be. It is important to note that outbreaks are down. We have really only 42 outbreaks. It says 46 from yesterday, but 42 outbreaks today in long-term care homes across the province that involve residents. But unfortunately, have to note that second wave mortality, that's the total number of deaths that we've seen since September 1st, has now surpassed the total number that we saw in the first wave. Total number of deaths in the second wave today would be 1,894 deaths in long-term care homes. Now, this is not by accident. what we can see is that this has been the result of both a reduction in community spread. The stay-at-home orders help reduce the spread in the community, and that actually stops the virus from getting into long-term care homes. It prevents the transmission of viruses into long-term care homes. And then the immunization protects people in those long-term care homes. And so I'm showing you two charts here that really represent the modeling of what would have happened had we not had the lockdown orders and the prioritization of long-term care homes for vaccination. That's the orange curve, and you can see the blue curve is what we actually saw. And so it's a substantial reduction in this chart in cases both for residents. It's more than 1,500 cases avoided between about December 14th and February 10th, and a substantial number of cases, again, still for healthcare workers. Important to note that the rate of transmission among healthcare workers was about 75% less at the point that we're able to measure here compared to controls in the community. So a substantial reduction in transmission, largely due to the lockdowns and the vaccination. And as or even more importantly, in this period, 326 deaths averted, we estimate. Now we know that one of the big drivers of the transmission of the disease is mobility, and we've showed this chart and tried to update it each time over the last several briefings. You can see Ontario is still at this low level here of mobility, not having come back up to a pre-holiday level. What's important to note here is that it is starting to trend up a little bit, but as importantly, at any given level of mobility, the variants of concern will lead to more transmission. And so it's this issue of really trying to adjust for the variants of concern, which are much more transmissible, much more easily spread from person to person. This gives you an idea now about the spread of the variants of concern and about the alarming speed with which they can spread. If you look here at about January 25th, we're estimating less than 5% of the total number of cases were variants of concern. And yet by about February 22nd, we're looking at almost 20% or around 20% of total cases are variants of concern. So 5% to 20% in about a month is a substantial rate of growth, and we've seen in a number of jurisdictions around the world, and we'll show some of this later on. As the variants of concern start to increase, so do the case rates. And even places that look like they had it under control, like say France or Germany, are now seeing spikes in some of their communities and case rates either leveling off or starting to grow again. This chart gives you an idea of just how we look compared to other jurisdictions. The gray bars going up there are the percent of cases that are variants of concern in Ontario. And you can see the different lines there, the black for the United Kingdom, the red for Denmark, the purple for Switzerland, the blue for the Netherlands, and the yellow for Germany, all showing that same type of growth. And we anticipate, regardless of our ability to control total spread of cases, that we'll continue to see the variants of concern outcompete the wild-type variant, or the variant that we've been dealing with up until now, and become the dominant form. And as they become the dominant form of the virus, they're likely to actually increase case rates again as we move forward. Yeah. I want to talk about what this means for case growth. The first thing is this creates a great amount of uncertainty in estimating our case growth over the next little while. If, for instance, by good fortune and the extension of public health measures, we're able to continue the current decline in cases, you can see in that dotted line we actually get down to a very, very low number of cases by the end of March. However, what we think is probably a more reasonable sort of best case scenario, that blue line, that low, means that we really only get down to just over 500 cases by the end of March. The best sort of case scenario based on estimates of the increased transmissibility of the variants of concern, the date at which we believe the variants of concern were introduced into Ontario based on their growth, the timing of the public health measures, is that yellow line, which is the medium bar there. That likely takes us back up over 2,000 cases a day by the end of March. And a worst case scenario, or a much more serious case scenario, is that purple line, which shows actually a third wave cresting there, close to 4,000 cases a day, due largely to the variants of concern and their ability to spread, particularly in the absence of public health measures. I think it's important to note, we're hoping, as we always do, as we apply public health measures to avoid a worst case scenario. but a United Kingdom type scenario where cases tripled in about a month is not necessarily off the table. On this slide, you can get an idea of COVID-19 hospitalization rates and the ICU occupancy across the province. As cases have declined, thankfully so have hospitalizations. That's the orange bars on top. We're at about 685 or 690 hospitalizations right now. You can see ICU use, though ICU occupancy has actually started to level off, and so the hope for decline in this has leveled off, and we're actually, I believe, in the fourth straight day of increases in ICU occupancy. This is talking about the most intense level of care within hospitals. We're up to about 316 intensive care unit beds occupied at this point. Now again, returning to how we model the impact of the growth in cases on ICU occupancy, which remains a critical indicator of how we're able to manage through the pandemic. You can see that in on every case, we really do stay at or above the 150 bed threshold. That's the threshold at which we believe there does begin to be impact on the amount of care that can be provided. Under the worst case threshold, you see that we actually do start to get back up into a very sort of challenging area of occupancy, about 350 or maybe more ICU beds occupied by the end of March. What's important to note here is that ICUs, when COVID patients enter the intensive care unit, they're often staying much longer than other patients. They require more intense care often than the patients who are already in the intensive care unit. And so you can actually see perhaps both a greater strain on intensive care units that's presented here, but you can also anticipate that likely this will flatten out even more before we really get to about 150 as those patients stay longer and longer periods in the intensive care unit. Here is some good news. We are seeing more and more Ontarians getting vaccinated, and focusing coverage on areas where the impact is greatest will be an important tool and protection as we move through the pandemic. The blue line here describes Ontarians who have received at least one dose as of a few days ago, and the orange line reflects individuals who've received both doses and are fully vaccinated now under the vaccines that we have here. Important to note that there is protection that starts with the first dose, and so it's important to see both the blue and the orange line move upwards in terms of protecting Ontarians as we move along. Now, I think it's important to try to put this now into a longer-term perspective as well. The next few months are really key to maintaining our gains and to achieving a declining pandemic in the summer. I began my remarks by saying that we could be looking towards a much better summer, and even a summer, this summer being better and more open than last summer. But it really requires us to maintain the gains that we've achieved over the last little while. There's a number of reasons why we believe that a better summer is possible. The combination of the vaccination and the public health measures have helped reduce transmission. The continuation of the stay-at-home orders in some public health units have been an effective brake on transmission in those larger communities. And the stay-at-home orders overall, despite how painful they are, have actually helped break both the spread of the disease and the spread of the variants of concern. The vaccination focus in long-term care homes has helped bring down both deaths and cases. It tends not to bring down hospitalization, but it has brought down both deaths and cases. And vaccination of older age groups and high-risk communities will drive hospitalizations and deaths down further as we look at this. It's important to note as well that we're facing a changing sort of physical environment. As the weather warms up in the late spring and the summer, that means more time outdoors, and that also means less time inside, in crowded spaces, in closed-in spaces, in spaces with poor ventilation, and that helps break transmission of the disease. And looking at historical models, like the 1918 influenza pandemic, we believe that the introduction of vaccination, the effective use of public health measures, may mean that we both are able to control spread more, but also confer immunity in a much more safe and reliable way than in previous pandemics where we truly had to rely on the spread of infection alone. The major challenge right now becomes how to protect the health system over the next few months and closely monitor the spread of all types of cases while accelerating vaccination, which will provide that protection. And just to note, we should expect flares in communities and settings where risk factors make people vulnerable. Any type of congregate setting where people are living together will increase the risk of transmission. Any place where we've not been able to get penetration of vaccination will increase the risk in those communities, not just for the people who haven't been vaccinated, but really in those communities entirely, particularly if we see new variants emerge or we see variants that are truly vaccine resistant emerge. So the path ahead is clear that we could have a much better summer, but we do need to be ready and we do need to respond very quickly to how the pandemic changes. And we'll get a better read on some of that over the next couple of weeks, but important to stay, regardless of that, particularly vigilant over the next while. With that, we'll come back to the key findings. And just to kind of reiterate, variants of concern are spreading. The next few weeks are really particularly critical to both understanding and controlling the spread of these variants. But we can keep the gains that we have made by watching spread very closely and by loosening public health measures only very carefully. We must be nimble in applying public health measures to extinguish flare-ups, which will happen quickly, but we can move towards a much better summer. I'll end here with a list of the contributors and turn it back over to you, Dr. Williams.
Okay, well, thank you. And I'll have some comments to follow up on Dr. Brown's presentation. And as always, challenging, some ways reassuring, and other ways raising the alerts and keeping those where we need to. But I'll comment on that in a moment. Let's look at the numbers over the last while. Since last update on Monday, we had an additional 3,167 cases of COVID-19. That was 975 cases on Tuesday, 1,054 cases yesterday, and 1,138 cases today. So you can see we're always hovering around this 1,000 mark for the last while. But as Dr. Brown alluded to, there is some sense maybe it's starting to move back up again, but we're going to have to watch this very carefully. Of the cases reported today, there was 339 in Toronto, 204 in Peel Region, and 106 in York Region. Our current 7-day average for the COVID cases is 1,099. That's up a little bit from 1,016 a week ago. Again, raising the concern that Dr. Brown had talked about. Are we level, or are we starting to see an increase as they were concerned about with the modeling 2 weeks ago? While Dr. Brown has noted that our deaths in the last 7 days are down, unfortunately, because it is a delayed metric, we still had an additional 44 deaths since Monday's update. And sad to say, and those are, of course, extending condolences to the families and members there, because these are significant losses for them. And the 7-day average of deaths is down slightly to 25, or is down to 25, but that's an increase of up from 2 from 23 last week. But some of the last few days, as Dr. Brown's alluded to, and we may be able to report on that next week, showed some ongoing improvement, especially as we have been completing our vaccination of our long-term care residents and staff. The hospitalizations, the intensive care use is also fluctuating, and it is increased up to 283 from 277. So we've seen that, as the graph showed in Dr. Brown's presentation, a leveling at this time, hanging around that number, but it could be tending up again a bit. But the hospitalizations overall, surprisingly enough, is down from 758 to 687 this week. So we see some directions changing there as well. Our testing still is robust, especially in the middle of the week here, as we often see a dip during the weekend, and then it comes back up again. So we did over 66,351 tests for yesterday, which was reported today as a positivity rate of down to 2%. We're having another over 60,000 processing for reporting again tomorrow. So the volume of testing during the middle of the week is not abating. This rate of 2% is our lowest that we've seen province-wide since mid-October. Going over to the variants of concern, and we're continuing our aggressive testing, looking for any positive PCRs or any noted, to have them vetted through our 501 PCR variant testing, and then a number of those going on to full gene sequencing. So far in Ontario, we've experienced a dominant of the B117. Here we're supposed to use the numeric term rather than the title. This is the one that previously was identified in the UK. And that's up to 449, an increase of 54 from yesterday. Again, agreeing with what Dr. Brown's concern, as the variants of concern are increasing in numbers as well as the percent, as they noted, heading up to 20%, which I'll comment on in a moment. We also identified 11 of the B1351, the so-called South African variant, and that was up 2 from yesterday, and we continue to have some others tested and followed and monitored. We had our 2 previously noted P1, or the Brazilian variant, that were identified, and that was up 1 from yesterday, so we had 2 pending, or 1 pending, 1 confirmed. Now we have 2 confirmed in there. To date, we've screened 17,651 positive samples were screened, and we had a positivity rate as of this document here of 11.3%, but we've seen that increase over the last few days, and as per the slide deck that Dr. Brown showed, we are up to 20%, just under that, as of now, and that's up from 5% at the end of January. So in a way, we've seen a doubling about once every 2 weeks, which is better than what we were anticipating, but concerning nevertheless. So we're up from 5 to 20% in a 4 to 5 week period. We have screened 5,601 were screened for the mutation, and 885 of those in this document came back positive with a rate at this time of 15.8%. So there are daily fluctuations, but the overall 7-day average, as I said, is moving up to just under 20%. So what does that mean? So as Dr. Brown's alluded to, we are in this interphase period. They used to use the terms precarious or tenuous, and we have to be very cautious. So we're in this crossing over where someone used the term, I guess we've been at this a year now, they called it classic COVID, as compared to the variants of concerns. And as that goes down, we're starting to see the variants of concern rise up. And it's a matter of how well we're going to try and keep those under control. The rapidity of the rise down, ideally, of course, trying to get it to flatten in there, but we can't make that conclusion at this stage. We may be able to slow it down instead of doubling every 5 to 10 days, maybe a bit slower. So there is some good news in that, but concerning nevertheless. And we're seeing outbreaks and cases related to that in various parts of the province, and even some that haven't had any, you see flare-ups in certain areas that become concerning. So we're continuing to look for them very carefully and trying to assess by health unit, because all of us, 24 of our 34, have had at least one variant of concern reported to them, and some, of course, more than others, and we have that data on our daily reports. So while we want to look for the summer, we know that as the days are getting longer, more sunlight, not in the minus 10 to 15 for Toronto and up north, a lot colder. There's more activity outside and being careful, and that's the point. While we are allowing some areas to move in the framework, and we'll be getting some reports and recommendations over to the Cabinet, which we're reviewing those tomorrow and making decisions, it's not everything open up. Even in the green zones, we have our public health measures in place. The critical personal ones are not changing. The masking, the requirement to stay in your household, the requirement to, if you're out in public, to wear, to keep the 2-meter distance, to, if you're ill, to stay home, get tested if you think it's necessary. Follow the public health directions. If you're identified as an exposure, even on your COVID app, if it tells you, you go and get tested and get assessed. Because more and more, the variants of concern can transmit quite quickly and quite rapidly with a very small encounter that you thought you might have said it was safe, it may not be. And so you have to be even more vigilant personally, even if you find in your color zone, there's some services that now you are able to access. I would say do that very judiciously, very carefully, limited. It's when you need to go, not just it's nice to go, because you still can be exposed in some of those settings unless you're very, very careful. So we want to emphasize that as we move forward in these next few weeks. It's just going to be very an important time to stay, and I was really pleased at the graph showing the mobility. It shows that Ontarians, and I've known this before, most Ontarians are staying very serious about staying restricted and staying home, stay local, and going forward in that. And as we now have more vaccines arriving, we're now rolling out and we're starting to get looking at the next stages and how we're going to do that as we move from the high-risk community towards more and more what I know that General Hillier talks about remote immunity, and I'd like to move towards what I call community immunity, and we'd like to move to that assertively over the next number of weeks and months, because our priority is to vaccinate and immunize everyone that can be. And so that's our target, and we want to move steadfastly, assertively, carefully, and with documentation towards that goal. As we now hear more vaccines are becoming available, more are in the process of being approved. So we've gone through this quiet time. Unfortunately, we had to do that, and we're now moving to the next phase. And I know the General is saying all ahead, full steam, and we would like to be able to do that. So those are the comments, and now back to questions from the media for Dr. Brown or myself.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Anthony Fury with Post Media. Please go ahead.
Hi there. Thanks for taking my question. This one's for Mr. Brown. You've mentioned multiple times today that lockdowns have been the key driver of what's brought cases down. And yet we're hearing from more experts who are pointing to how jurisdictions across North America that did not have comparable lockdowns also saw massive drops in cases at the same time as Ontario. So I'm wondering, how do you reconcile this situation that many states suggest lockdowns aren't, in fact, the main contributor to declining cases?
Thanks for the question. There's been a lot of work on this and a number of studies, and every time people do probe into it, there is a much more sort of important combination of things like lockdowns or a very big spread through the community with a very high death toll associated with it. In some of the places you might be noting, the toll can be 3 times or higher than what we've seen here in Ontario.
Follow-up?
Yeah, you mentioned earlier about extinguishing flare-ups should they arise. The Sun was speaking to Dr. Crean Kurji, of course, York Region's chief medical officer, just the other day, and he was talking about he doesn't want to move backwards. He's thinking of moving forwards, as in not looking to go further into lockdown. And he's talking about targeted responses moving forward, about the idea that a year into this, there is now the data to make much more sort of granular choices. Is this kind of what you're talking about here, not going back into lockdown at all, but more specific targeted responses?
I'm probably looking a little bit farther ahead than Dr. Kurji. What we're going to see through the summer, and we're going to see even into the fall, is isolated flare-ups. They may just be in a long-term care home. They may just be in one congregate setting, but we need to move very quickly to make sure that those don't spread into a wider community-type process.
Next question.
Your next question comes from Chris Glover with CBC News. Please go ahead.
Hey guys, thanks for taking our questions. My question is kind of around the restrictions that we've seen eased, for example, in York, as you were just talking about there. But across the GTA, we have several regions that are in red zone. And I'm just curious, when you say that we need to be careful as we go forward not to lose the gains that we've already made up, are you saying that right now with these places in red zones, that would lead to the best case scenario, the middle case scenario, or the worst case scenario?
I'll start, and probably Dr. Brown has something to add because you're trying to ask it how it compares to the modeling data. So as you can see around the area, from the gray lockdown zone to the red, there's only a slight increase in some services being available in there. But the key factor in there we've seen is people's personal behavior limiting their exposure. It is person to person. And if you limit those exposures to your household, follow the 2 measures. Even if you actually go to some facility, you still have to be very vigilant on what you're doing in those locations in there. And I would add to the aspect that Dr. Kurji was talking about, even with the variants of concern, that as you do more case contact management, we're finding that compared to the past when we were up to 50, 60% were non-epi linked, with our variants of concern right now, well over 77 to 80% are linked to cases or contacts, and 7%. So less than 15% are not epi-linked. So their capacity as a local medical officer and team to keep on top of that case contact management is very critical, because that determines what extra steps you may want to take, including putting out your own Section 22s to deal with aspects that you identify as areas of increased concern. So while they are at a red level, for example, in York Region, that does not preclude a medical officer of health who has a certain sector or area that's concerning to write a Section 22 to limit that exposure if it seems to be lacking control in the respective jurisdictions. And I believe that's what the medical officer of health in York Region, Dr. Karim Kurji, was alluding to.
Follow-up?
I'd like to hear from Dr. Brown on that first one, if possible. But the follow-up would be for Dr. Williams. We know that the Simcoe Muskoka Chief Medical Officer of Health has been saying that a stay-at-home order back for them would be essential given the rise of cases that they're seeing. And so I know that that's something that he says he's spoken to you about. He's raised his concerns, and he's just awaiting a decision from you. I'm just curious, where are you at with that decision on whether or not the emergency brake would be pulled and Simcoe Muskoka would be put back into lockdown?
So with the medical officer of health for Simcoe Muskoka, Dr. Gardner, we've had some discussions. We've looked at the data. While his numbers coming up to this time were in the low range, nearly down into the orange level, we were not at all interested in letting that move down to that any level below red. In that, we had seen his data recently, and we're asking for some updates later tonight to see how it's faring over the last few days, as he's been investigating some ongoing concerns with some newly identified variants of concern. And I think what he has tabled and saying he's concerned that maybe this might have to happen in his area. And of course, we are going to have ongoing discussions with Dr. Gardner to see how that is going to pursue its in further investigation. Stay at home, of course, is what we're trying to say anyways, even if you happen to be in a red, orange, or yellow, is that if you don't need to go out, don't go out. And that's what I've been saying. The important thing is personally adhering to those principles, because that's what causes the spread. But he is worried about travel up to his area and travel within his area that could be potential sources of spread at the same time, and how that might be undertaken to limit that kind of potential source of spread. So we're having ongoing active discussions with Dr. Gardner. And now I'll let Dr. Brown answer, I think, the question you're asking me for about how that would affect the curves and graphs that Dr. Brown had noted.
Thanks, Dr. Williams. So I think I can understand entirely why we'd want to relate the framework to the types of curves that we're showing. Where we are on the curves really is a function of how fast we're growing in terms of cases. And for that reason, I don't want to relate too much to the framework, because the speed with which the new variants of concern can transmit that, case we keep on coming back to, which is the case in the United Kingdom, where they really tripled their overall rate in about a month. It's the speed with which it's changing, not the actual level, that we need to watch very carefully, because by the time it hits that actual level, it's accelerated enough that it's going to take a long time to actually get the disease back under control. And if you want to get a sense of the anxiety this is producing in some countries, I believe that we've seen an exceedingly strong lockdown now in the south of France, with a very small range of people, small distance around home, which people can move. I believe it was 2 kilometers, really trying to get control over what's going on there with the growth and the spread of the variants.
Next question.
Your next question comes from Victor Kurowski with Acadia Broadcasting. Please go ahead.
Thank you very much for taking my question. This one's for Dr. Williams. Doctor, could you please speak to the COVID-19 situation and projections for the Thunder Bay District and your concerns and the need for a lockdown and virtual learning for schools?
Yes, we have and are concerned very much about the cases in the Thunder Bay District, mostly pertaining to the greater Thunder Bay area. and have been concerned as their numbers, as the graphs, and Dr. Brown has demonstrated that, has escalated very quickly up over 100 per 100,000 cases in that jurisdiction related to a number of events that have sequentially moved along from outbreaks in correctional centers into the community side, into community groups, into school, some sectors there. So we have been working certainly with Dr. Janet DeMille, the MOH in Thunder Bay, and team and staff there, as well as with other sectors, moving in resources, whatever they would like to have to assist in the attempts and work to curtail this outbreak and to bring it under control. That means having discussions with them pretty well daily on how it's proceeding, what other assistance we can give, and then of course making recommendations of how we could assist with what zone they should be within the framework. And myself, I have been recommending that along with Dr. DeMille, that we would consider lockdown. We'll try to affirm that with further discussions with them this evening, and then how we make recommendations to Cabinet tomorrow for their decision on the matter. But certainly it is an area of concern, and how to control that there, because not only the community, but it is a hub at times for still some travel up to northern remote communities, and we know they have put all their systems in place to check on that. And as well, we have been through our remote immunity doing an aggressive vaccination program in all those communities, because we want to keep it at bay out of there, and to make sure we protect those remote communities, because they're a distance from the acute care services that are available at the Regional Health Sciences Center there in Thunder Bay. And we're also concerned about their homeless populations, as well as their shelter house that has been of concern. So a number of factors, and having been there for many years, I'm aware of the dynamics and issues. So there is a great not only interest, but great concern, and we want to give them all the help we can to give them to bring this under control as soon as possible.
Follow up?
At what point then would you be comfortable in lifting any possible restrictions? And could you just talk about virtual learning for students? Is it required now then?
So the virtual learning for students, as we haven't done in other parts, it's fully within the power of Dr. DeMille to put out a Section 22 to ask the schools to switch to virtual. I know this is being considered. There have been communications also with the Boards of Education, as well as with the Ministry of Education. So I think that's something that's being potentially considered, because they've had outbreaks in now 3 or 4 school centers with a number of cases. Not a large number in the school, but the potential of it spreading. And it may be best at this time to put a pause on that. But again, that is a decision that will be made at the local level and can be undertaken with a Section 22 order.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi. Thanks. I just wanted to pick up on something I think Dr. Brown mentioned, and maybe both of you could respond to it. Just the concern about the ability of the virus to skip across sort of our artificial boundaries. As you mentioned, just going across the road I thought of was Steeles Avenue, obviously with York Region being in red and Toronto being in gray. How much of a concern is that people moving now, as York has got some stores and restaurants that are open in a limited way and Toronto doesn't? How much of a concern is that type of transmission?
So in our discussions with the medical officers of health in Toronto, Peel, and with others around the GTA, and more specifically with the medical officer of health in York Region, Dr. Kareem Kurji, when this issue was raised, he said he understood that happened before, and he felt that they can control and handle that, and that he felt definitely and strongly with his leadership in his community as well, that they could do okay with the red zone, those Steeles Avenue and streets permitting, because he felt that they can make in controls if he had to and deal with it. We will monitor the situation as we did in the fall, into the December season, as when we went into the modified 2, if you remember, and some steps there. So it's a dynamic one. We'll continue to watch that. As I said, the distances we have to understand. And then, of course, Toronto and Peel are in the extended stay at home until next week, till the week of the 8th of March. And that's another decision that'll have to be undertaken at that time. But that's not for this week. That's for next week. So it's an ongoing discussion, one of concern and monitoring, and that's what Dr. Brown alluded to, is that like the analogy of the minefield, as you're stepping through it, you're trying to walk this course, and how sure are you in this, and responding to the data and metrics very quickly if need be. So we'll continue to have the discussions with the medical officers in and around the GTA during this tenuous time. Dr. Brown, you want to make a comment?
Yeah, just, I think it's important to realize that what you're doing is that as people move from a community with a high rate to a community with a low rate, you're really moving people who are at greater risk into a place that is at lower risk and has probably less protections. So, at least in the way that we would model it or look at it, this creates a very substantial risk of that sort of difference in the risks, that risk gradient, but also the fact that you're maybe moving into a place that has less protections going on at that time. And so it does create a significant risk for transfer, and it does create a significant risk for outbreak.
Follow up?
And am I right then that the variants are, while still a major concern and still spreading quickly, we're seeing them spread less quickly than we had feared? Is that right?
Okay, why don't you start and I'll follow.
Great. So the short answer is yes. When we were looking at the rate of spread that we'd seen earlier on with what we'd seen in some of the international jurisdictions, we were worried that we would have seen a faster spread earlier. What we're seeing right now, and as we're starting to see in other jurisdictions that have maintained public health measures, it's a slower spread, a slower increase in the percentage of cases that are the variants of concern, but they do eventually turn the tide in virtually every jurisdiction that we can actually see with data right now.
Yes, and I think your question before, if you look at Dr. Brown's slide on the new cases per 100,000 in the health units, you'll see that the difference between Toronto and York is not that much as far as new cases. So the high and low zone, it'd be a lot different, and that's where we're very careful not to have like a lockdown next to a green, if we can, because it's such a huge difference between the two. There's a bigger difference between Peel and York, but even then, they're not like a doubling between each other. It still is concerning because these are not inconsequential numbers in either jurisdiction, and they're seeing VOCs in all three of significant amounts in some in York and Peel, actually superseding that thus far in Toronto. So they all have those same concerns they have to deal with.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Just wanted to change gears a bit to your testimony to the Long-Term Care Commission. It seems to me they were asking you some pretty tough and probing questions in terms of asymptomatic spread and did you follow the precautionary principle adequately enough? You seem to be taking a fair amount of heat today on social media and elsewhere for your answers. So do you want to clarify anything that you said to the Commission?
Well, I guess I would have to say is that these are complicated questions. They require enough time to answer. Sometime in there's a fair amount to ask in a short period of time. Same as now, if I was to give you an answer to any one of those, it would take quite a bit of time that this media interview doesn't allow in order to talk about it with the concepts of asymptomatic transmission. And I know Dr. Brown and I could have a good conversation about it for half an hour because it is one that's still evolving and working through with the aspects around the testing methodologies, positivity, false positive, all this kind of commentary and things that come into the discussions and matter. We're continually getting update from the science table and things like the precautionary principle and how does it apply, and using my scientific advisors from Public Health Ontario as well as from the scientific table to give advice on their expert opinions that goes beyond the evidence and ask what should be done further from their compilation of expert opinion to develop recommendations in a concept of the precautionary principle. So I don't have time to go through all that, Rob, But I think it's part of that overall discussion. Some of those things that started with the commission, I think there's going to be good discussions on that, because in the end, we want to make sure if there's system-wide improvements necessary, what should they be? And that's why I'm always interested in going to say what can we learn, how we can handle this, and how we keep moving and building for the future on these issues too, because some things we have done well, some things I think we could do better. That's always the case, and we're always looking for that, including feedback and direction from our science tables that are continually analyzing not only how we do things, but how have others done things, and what can we learn from other jurisdictions. That's why we have people like Dr. Brown here on a regular basis to give us these updates from the science table.
Follow up, and this is the last question.
Yes, thank you very much for that. Now I'm going to switch gears again. I may be a bit early on this, but a lot of parents and kids are wondering what your thoughts are on this. Overnight summer camps. We have the variants as the wild card. It's been going pretty good so far, but as Dr. Brown says, they can take off. So given that we have this situation and we have vaccines, where do you think we're going to be for overnight summer camps in July and August, and what are your concerns?
Well, thank you. And we're getting a lot of, and with Dr. Brown talking about perhaps a better summer. And I like that. I like to think about that optimism. That gives us hope. We told our public to say, with vaccines coming, and as we're rolling out and doing all the population levels, we're waiting to see, especially if we get the adult population done, if some companies will be moving towards, and they're doing some case studies on younger youth down into the younger age groups. We got it down to 16. We're hoping to see if it can drop lower. I think with all those things in place, I'd like to think about that. I know it's a valuable aspect. Having been a camp doctor for a number of years, I know the value of that and how much it's such a great memory thing for many youth, and even the ones that get sponsored to go to these camps. It's a very big life issue. And so I'm hoping that through all our stringent measures, keeping things down, vaccinations being done and moving forward, new vaccines, more coming in, and getting approval for even wider age group, even youth and children. This has all great promise. So I'm keeping my hopes up, but we have to cover some territory first before we get there. And so if everybody keeps doing, that's part of this process of everybody staying to the task, keep these numbers down while the vaccines get caught up, we enter the greater possibility of a better summer, as Dr. Brown has alluded to. So we have a double task to do. Get vaccinated when your turn comes, and keep doing what you need to do to be personally protective with you and your household. No matter what framework setting you're in, you've got to do your personal job and keep yourself and your family protected.
Thanks, everyone.